My name is Dr. Tahir Akhtar and I am a clinical director in critical care medicine. Today I will be talking to you about the correct use of personal protective equipment or the PPEs. To understand the right personal protective equipment use, we must know how the COVID-19 disease spreads. Coronaviruses are mainly transmitted by large respiratory droplets and direct or indirect contact with infected secretions. They have also been detected in blood and feces. Under certain circumstances, airborne transmission is thought to occur from aerosolized respiratory secretions and fecal material. Transmission can be in the form of droplets or aerosol mists. The secretion droplets are large, greater than 5 microns in size, and contain viruses. Infected patients, they shed infective viruses when they cough or sneeze or shout or sing. They can travel up to 2 meters, but they fall to the ground quite quickly. The aerosol, however, are much smaller than droplets, less than 5 microns. The COVID-19 virus particle is 0.007 micron in size and can deposit deeper in the respiratory tract, like the bronchioles, and it remains suspended in air but cannot travel in straight line, and generated by special procedures called the aerosol generating procedures. They are intubation and extubation of a patient during manual ventilation and open suctioning of the respiratory tract. Other procedures are tracheostomy or tracheostomy related procedures like insertion, open suctioning, or removal of a tracheostomy. Bronchoscopy and upper ENT airway procedures that involve suctioning can be aerosol generating procedures. Upper gastrointestinal endoscopy, where there is open suctioning of the upper respiratory tract, or surgery and postpartum procedures involving high-speed devices. Some dental procedures like high-speed drilling, non-invasive ventilation like BiPAPs or CPAPs, high-frequency oscillatory ventilation, induction of sputum, or high-flow oxygen. After aerosol generating procedure, environmental decontamination should be performed. A minimum of 20 minutes, that is 2 air changes in hospital setting, is considered pragmatic. In patients that are suspected to be COVID positive, when you are coming in contact with these patients, you must wear eye protection, fluid resistant surgical masks, disposable aprons, and gloves. However, when you are in area where aerosol generating procedures are carried out, you must wear eye protection in the form of goggles, eye shields, or visors, filtering facepiece respirators, these is FFP3 respirators, long sleeve fluid repellent gowns, and gloves. The surgical masks, they provide a barrier to splashes and droplets. So cleaning the rooms, equipment cleaning, discharging the patients, or room cleaning in cohort area can be done just with a surgical mask. They can be used within 1 meter of patient contact to provide patient care, home care visits, diagnostic imaging, phlebotomy services, or physiotherapy. Always wear correct protective equipment. However, the FFP3 respirators are essential when you are in a mist generating procedure. The FFP3 respirators are essential where the patient is known and suspected to have an infected spread via the aerosol route, and when carrying out patients known or suspected to be infected with newly identified infectious respiratory virus. Always use the correct PPE to protect yourselves when you're exposed in the treatment of patients infected with COVID-19.